Thank you, Chair. Yes, this question is for James Bullion and Professor Martin Green. As well as coping with COVID-19, councils across the country are facing another year of cuts. My council, Luton, is no exception. It's currently facing a devastating financial impact of £49 million due to the pandemic and loss of revenue. So do you think local authorities in the care sector have the funding they need to cope with the immediate pandemic, a possible second wave, and the shortage of carers?
Chair, shall I go first?
Please go first.
Thanks. Well, I think, Sarah, the short answer is no. But I think part of the other issue for me was that when the 3.2 billion was allocated, there were certainly clear messages that that should be going to the front line of care. And that was what we as care providers heard. I think our colleagues in local government, because of the pressures on their budget, saw this money in a much more broad sense around some of the other things that they had to do. So I think one of the challenges has been that the government has not been nearly specific enough about where this money needs to go to. There seems to be no clear audit trail. So if I tell you that in my organisation, some of my larger providers who might deal with 100 different localities, 60% of those localities have not come and talked to them, never mind given them money. And I can supply the committee with a extensive list as to where those areas are. So I think one of our challenges is local authorities, and I really do feel for them in that they have so many different requirements and pressures, but also care providers, particularly in the midst of a pandemic, need the money in order to make sure there is the safety of their residents and staff at the top of the priority. They need the money so that they can cope with things like enormous increases in the PPE bill. And they also need the support of the NHS as well, as I've said. And of course, if you don't have that money, but you've had an expectation that you would get it. And in fact, I think the LGA and ADAS said that there should be an expectation you would get 5% for normal cost increases. And of course, the living wage went up in April by 6%, but then 10% more for COVID-related costs. And in many, many areas, that hasn't happened.
Thank you. James Bullion.
Well, first of all, on the broader question about is it enough, we've calculated in the Local Government Association and Society of County Treasurers, for example, that we think in the broad picture for local government, it may be as little as a quarter of what's needed because of the impact on the wider services for local government, which includes loss of income, children's social care, and so on. Specifically in relation to adult social care, I don't think the amounts within the 3.2 billions allocated to adult social care has been enough. On the issue about the money though getting to the front line, I mean, there is of course an issue here of timing and of, we got the money in April, here we are on the 19th of May. You would expect some delay in some areas sometimes in getting the money through. So I acknowledge that that has happened in some areas, but our recent survey of our members shows that actually the money is earmarked for adult social care providers, but the pattern in which local government has operated has differed across the country. So about a third of councils, instead of allocating money just straight out to providers, have said, come and have a conversation with us and we'll meet all of your costs. So there are examples of that taking place. There are other councils who've given a 6% increase and held back money to have a further conversation about costs. And there are some councils who've gone for a straightforward 10% increase in costs. There is, firm evidence though that councils are paying on accounts. They are, paying whether the care is received or not. They are paying in advance. Our indication from our members is around about 10% of money will have been paid out to providers in addition to normal payments in April. I just think because of the distributed nature of local government, as Professor Green is explaining, it's not easy to aggregate the evidence. But if you look at the national capacity tracker data, occupancy levels in care relatively stable up until last week. There have been a few instances of providers who have come forward to express worries about business, but we haven't seen the collapse. We're working very hard to make sure that that doesn't happen. But I think local government has stood up well. It's provided PPE, it's providing coordination with testing. I mean, the one area of perhaps sharper disagreement between myself and Professor Green is I think what works is local, not national. Actually, nationally, approaches to testing PPE have been very, very challenging. Where it's worked well, it's the local government and the local NHS coming together to protect social care. And that's the model that I would encourage the committee to look at.